You know, I got another question just now, and this is probably, it's a two-part question, but this is probably the most profound question that we've been asked thus far. What is a residency, and why do we need a residency? A residency in the medical field for physicians, and actually we have residencies now in the physical therapy arena. I imagine they have them in chiropractic care also. A residency program is for a student after they complete medical school and their internship. In some instances, the internship and the residency are actually coupled together. But the residency now is a deep immersion in the practice of their chosen specialty, your specialty being medical exercise training. And residency programs for physicians can be anywhere from 3 to 7 years. And during that period of time, they're literally in the hospital around the clock seeing patients. And what they're doing with seeing these patients is learning how to provide a high level of care, which includes the diagnostics, the treatment, everything, the management of that individual's condition from the moment they enter the hospital, they come to the physician's office until they actually have a resolution. We wanted to do that also in the medical exercise training arena because what we don't want is just simply pieces of education. We wanted to bring all of these programs together into one to say, here is a basic body of knowledge you need to have as a medical exercise professional. Now, you can go out after you finish the AMES and specialize in certain areas, but the AMES will be a deep dive into medical exercise training. We'll touch on a number of areas, including orthopedics, neurology, some oncology. We'll have guest speakers that will come in. So the idea here is the residency is a deep dive to improve your skills, to improve your thought process, and the biggest thing is to give you the ability to critically think and apply medical exercise training. Why do you need a residency program? For all those reasons I just mentioned. We found, and I had a conversation with a student who took our MES program and attended our on-site workshop, and we were talking about a client that she was working with. And she was asking about the client, and I was explaining a couple things that she could do. And with the 30 years of experience, I realized there were a couple of pieces that she missed. Now, there's nothing wrong with that. I mean, hey, as a therapist, I've talked to other therapists, and there's some things I miss along the way. But I also realized that 30 years of being a fitness professional, she had gone through a 2-day on-site workshop in our 44-hour MES program. There are going to be some pieces that she misses, but here's the deal, folks. You're seeing more and more medically based clients, and you're seeing them more complicated. So it was incumbent upon us to give you a higher level of education to now deal with these complicated clients. Because once they come to you, they can't go back to physical therapy because their insurance ran out. The doctor isn't available to talk to you at great length. So guess what? You got to figure it out. So what we wanted to do with this program was raise the level of professionalism, knowledge, and skill so you can deal with what's going on out there. And what's going on is there's a huge need for medical exercise training. So that's why we need the residency program.